So what I'd like to do today is provide an update on what the Allergens and Irritants Working Group has been doing. First of all, I'd like to acknowledge the members of our chamber orchestra. A number of organizations across the system have been involved. I'd like to specifically thank Janet Brown and Deandra Budd from CREAUD. Janet keeps us moving and keeps telling us you've got to make decisions. And that's really important. And Deandra came to us as a master's student from McGill and has stayed on and has done a lot of the background work in pulling all the literature together. As I say, the system partners and the other group that is in our chamber orchestra is the Ontario Lung Association. They've had a long-standing interest in occupational lung disease, particularly occupational asthma, so we're delighted that they're participating in our group. So our year one task was to identify priority allergens, sensitizers is the word used really in the respiratory community, and irritants for lung and skin disease. So when I went back and looked at the slides I used last year at October, I spent a lot of time talking about occupational asthma and occupational contact dermatitis, and in particular going through list after list of all the things, the irritants and allergens that cause both those diseases. So our challenge was, how do we get from hundreds and hundreds of agents down to, and we decided on 4. So what we've done, the group has had 4 meetings since we were formed, and we've basically assembled and reviewed the literature. Particularly, we looked at workplace studies where investigators had gone out to a particular type of workplace and looked at either asthma or dermatitis in the workplace to identify the potential agents. We've looked at clinical studies, which are particularly informative for the skin side. We've looked at compensation statistics, particularly from WorkSafe BC. We're still awaiting our Ontario statistics. And the other thing we did, because as I say, there's hundreds and hundreds of agents that are possible things to be the priority. So we actually had the opportunity to pull 2 expert groups, international groups. So a group of primarily occupational dermatologists from the European Union, and asked them what they would pick for their top 5 priority skin allergens and irritants, and also a group of occupational respirologists who we asked about these lung sensitizers and irritants. From that list, we created a short list, and Deandra provided basically briefing notes for each of those agents or groups of agents. The group then met, looked at those, and voted, and we voted electronically and have come up with our 4 priority allergens and irritants. We yesterday afternoon presented those to the implementation team, and there was agreement to take them forward. So I made my slides last night, and I'm really excited to tell you what our 4 priority agents are. What I'm not going to do is spend a lot of time talking about each. What I am going to emphasize is what's the value add. So why did we, in addition to it's common, what are the other things that made us think this might be the right time to look at this? So for lung irritants, we've picked cleaning agents. Certainly in a number of occupational asthma conferences at PEPI's the last time, cleaning agents was a major focus of the event. And the other important thing about cleaning agents, although we've identified them as our lung irritant, they are also have lung sensitization capacity and are also skin allergens and irritants. So they in fact cover the entire range of diseases we're interested in. The skin irritant is wet work, which is not kind of a traditional chemical, but is nonetheless the most common skin irritant when you look at large studies of irritant contact dermatitis. The other really important thing about choosing wet work is it provides tremendous system alignment. So Public Health Ontario, after SARS, there was a lot of concern about infection prevention and control and environment and occupational health not really working well together. And certainly when the hand hygiene programs were developed and introduced in Ontario in the past 10 years, there was a very strong emphasis from infection prevention and control, not as much contribution from the occupational health side. Public Health Ontario, about a year ago, brought together, there's 2 groups, so they're directors of infection prevention and control and environmental and occupational health, and have set up a working group to look at dermatitis in healthcare workers. So hand hygiene is contributing in a major way to causing dermatitis. So there is now a working group developed. It's got a number of stakeholders on it, and in the next year they will have their findings, recommendations, and a variety of tools probably developed. So this is a tremendous opportunity for us to work with Public Health Ontario, who are putting a lot of resource into this topic. So that's one of the reasons, in addition to it being the most common skin irritant, that we chose it for attention now. Skin allergens, we picked a group of agents, preservatives, and there are a number of common skin allergens, and we decided on preservatives for several reasons. There are two major groups of preservatives we're looking at from the skin allergen perspective. One are formaldehyde-based allergens, which includes formaldehyde itself, but also a number of substances which release formaldehyde when they decompose, so things like quaternium 15, diazoledinourea, bronopol, common things used in a number of products. And of course, formaldehyde is also a carcinogen. And the other group of preservatives that we are looking at are the isothiazolinones. And again, this fits with the emerging topics piece. So in the last 5 years, there is really a recognized epidemic of allergic contact dermatitis to methyl isothiazolinone, initially reported in Europe, but certainly we're seeing it in North America. So this gives us a real chance to not wait 20 years when we have thousands of cases and to try to intervene and do something to really kind of deal with methyl isothiazolinone. And finally, our lung allergen are isocyanates. A very kind of traditional lung allergen, but nonetheless, it is a designated substance. There are some new OELs for several isocyanates coming out, and we felt that it would be a very good choice for the lung allergens because of its designated substance status. So those are our 4 priorities, so we're delighted that we've landed them. We could spend many months, if not years, debating which the 4 should have been. I think what's really important, we have this opportunity to move forward, so we've selected the agents and we're moving. So what are we going to do next? So we're going to finalize those summary documents. They will include the typical workplaces and jobs where there are exposures to these agents. So from a sector perspective, we will identify for the sectors where you're likely to see these agents, which can again target activities. We will look at the resources available in the system with respect to resources, education, and training, and identify the gaps. And we also will continue to work with some of our other working groups, the Intelligence and Data Working Group, which is a key, which Victoria will talk about, and also the activity around occupational history, because as Val said, this is a group where certainly often the exposure isn't recognized. In the healthcare setting, the association isn't recognized, and so the work-relatedness is never made. So that's another important connection for this working group.